Emergency dental pain. One of the worst pains for humans is they say is dental pain. Others probably is delivery pain or renal colic. So whenever people have dental pain, they go just berserk, they go mad. So you are actually looking for a dentist to solve your problem. It may be in the middle of the night. Most often emergency dental pains happen in the middle of the night for whatever reason. Okay, so then you are actually looking at what exactly has to be done. So most often you can just go to any emergency medical premises. They can give you an emergency pain relieving injection or tablet. Okay, and you have to know what exactly not to do. Sometimes even medical people don't know. Few common things which are used for pain is application of hot and cold. We call this hot fomentation or cold fomentation. What you have to remember is applying hot to the tooth which is causing pain will actually temporarily relieve the pain, but will actually complicate it very severely. It can lead to a bad swelling, and it leads to a prolonged dental infection and failure to achieve good anesthesia when the dentist is trying to treat. So first and foremost, what you have to remember is don't apply anything to the affected area. So it can be disastrous. Okay, and it can actually if a patient is having some medical issues, it can actually complicate the issue. There may be an emergency medical visit which may be required. So the giving a painkiller is essential. In Western countries, you have over-the-counter painkiller medications. Most often they work for about 4 to 6 hours. But if the dental pain is severe, it will not last for more than 1 hour. So sometimes an emergency dental visit is essential. And we at Denta Care, we provide emergency dental services, but don't utilize this services for non-emergency. So we are happy to provide that emergency services. So before you come to us, you take care, and especially when you're traveling or something, sugary things can actually flare up the dental pain. Anything sugary, it could be glucose drink, or it could be tea, coffee, milk. So these are the things which can actually flare up. So you have to be careful that you don't take any high sugar or anything which can be an easy substrate for the bacteria. The next thing is try and see a dentist, and you don't actually have to start the dental treatment. What I always teach my students is also just numb that area up, and the local anesthetic will easily act for 2 to 4 hours, and if required we initiate the emergency treatment. So giving a local anesthetic to the affected tooth will provide a huge relief to the dental pain. So you have some time to actually think over it. And here I can correlate my own story. I was in my internship when my mother had a severe dental pain, and I didn't have access to a dental surgery in those days, and I was doing my internship, and my mother was just popping up severe painkillers every 1 hour. So this is what I don't want, because taking painkillers every 1 hour will actually not help, and actually it can be dangerous to your general health. It may damage any of your vital organs, especially the kidneys. So these days dentists are available in most of the places, so you can actually seek emergency dental services, and don't pop up emergency pain killing medication every 1 hour. The simplest effective thing is to give you a local anesthetic, which any dentist can give you. The other things I've talked about, hot fomentation and cold fomentation. Apart from this, people do suggest a lot of things. People they know or they don't know, we don't know, but they keep applying some topical medications like Zandu balm or Amurtanjan or whatever fancy things they want to rub into that area. It actually temporarily probably gives you a relief, but actually tends to complicate. So don't apply anything topical. So To summarize, don't apply anything hot or cold or any topical medication. Just take an emergency painkiller if you are allowed to, or see a medical practitioner close by who can probably give you an intramuscular pain killing injection. And if a dentist is available, go see him and get a local anesthetic to immediately relieve the pain, and if required, the dentist will initiate the emergency treatment.